Question 1. Which action best demonstrates the nurse's use of clinical judgment when assessing a pregnant client in the third trimester? A. Reviewing fetal heart rate trends over time. B. Documenting vital signs after assessment. C. Following the provider's orders without questioning. D. Delegating assessment findings to assistive personnel. Answer: A. Reviewing fetal heart rate trends over time. Rationale: clinical judgment involves analyzing patterns and trends to anticipate complications. Reviewing fetal heart rate trends allows early identification of fetal distress. Documentation alone does not demonstrate judgment, and blindly following orders or delegating assessments is unsafe. Question 2. During the assessment phase of the nursing process, which finding requires the nurse's immediate clinical judgment in a laboring client? A. Cervical dilation of 4 centimeters. B. Fetal heart rate decelerations after contractions. C. Contractions occurring every 5 minutes. D. Maternal blood pressure within normal limits. Answer: B. Fetal heart rate decelerations after contractions. Rationale: late decelerations suggest uteroplacental insufficiency and require prompt intervention. The remaining findings are expected during normal labor and do not indicate immediate concern. Question 3. True or false? Prioritizing maternal airway, breathing, and circulation before fetal assessment reflects appropriate clinical judgment? A. True. B. False. Answer: A. True. Rationale: maternal stabilization is the priority because fetal oxygenation depends on adequate maternal airway, breathing, and circulation. Ignoring maternal ABCs can worsen both maternal and fetal outcomes. Question 4. Which nursing action best reflects ethical clinical judgment when a laboring client refuses a recommended intervention? A. Respecting the client's decision after providing complete education. B. Documenting refusal and notifying security. C. Proceeding with the intervention for fetal benefit. D. Asking family members to override the client's choice. Answer: A. Respecting the client's decision after providing complete education. Rationale: ethical nursing practice requires respect for patient autonomy. The nurse must provide accurate information and support informed decision-making, not coerce or override the client's wishes. Question 5. Yes or no? Should the nurse question a prescription for oxytocin if uterine tachycystole is present? A. Yes. B. No. Answer: A. Yes. Rationale: uterine tachycystole can compromise fetal oxygenation. Clinical judgment requires the nurse to recognize unsafe conditions and question or stop interventions that may cause harm. Question 6. Select all that apply. Which findings require immediate nursing intervention during the postpartum period? A. Heavy vaginal bleeding saturating a pad in 1 hour. B. Firm uterus at the midline. C. Foul-smelling lochia. D. Maternal pulse rate of 120 beats per minute. Answer: A. Heavy vaginal bleeding saturating a pad in 1 hour. C. Foul-smelling lochia. D. Maternal pulse rate of 120 beats per minute. Rationale: excessive bleeding, signs of infection, and tachycardia may indicate postpartum hemorrhage or infection and require urgent intervention. A firm midline uterus is an expected normal finding. Question 7. Which situation best demonstrates the nurse's use of prioritization in maternal clinical judgment? A. Teaching breastfeeding techniques before assessing vital signs. B. Assessing a client with severe headache and visual disturbances first. C. Completing documentation before responding to a call light. D. Administering scheduled medications before assessments. Answer: B. Assessing a client with severe headache and visual disturbances first. Rationale: severe headache and visual disturbances may indicate preeclampsia, a life-threatening condition. Clinical judgment prioritizes potentially life-threatening problems over routine care. Question 8. True or false? Evidence-based practice supports the nurse's clinical judgment when managing maternal complications? A. True. B. False. Answer. A. True. Rationale. Evidence-based practice integrates current research, clinical expertise, and patient preferences, strengthening clinical judgment and improving maternal outcomes. Question 9. Which communication strategy best supports collaborative clinical decision-making in maternal nursing care? A. Using SBR when reporting a change in maternal status. B. Waiting for the provider to assess before speaking up. C. Communicating concerns only during shift report. D. Documenting concerns without verbal communication. Answer. A. Using SBR when reporting a change in maternal status. Rationale. SBR promotes clear, structured, and timely communication, which is essential for safe and collaborative maternal care. Delayed or incomplete communication increases the risk of errors. Question 10. Select all that apply. Which actions demonstrate effective risk management in maternal nursing care? A. Verifying informed consent before procedures. B. Documenting abnormal findings promptly. C. Ignoring near-miss events if no harm occurred. D. Following institutional safety protocols. Answer. A. Verifying informed consent before procedures. B. Documenting abnormal findings promptly. D. Following institutional safety protocols. Rationale. Risk management focuses on preventing harm through informed consent, timely documentation, and adherence to safety protocols. Ignoring near-miss events prevents system improvement and increases future risk. Question 11. A postpartum client suddenly develops dyspnea, hypotension, and altered mental status 25 minutes after delivery. Which intervention demonstrates the highest priority clinical judgment? A. Administer oxygen. Place the client in Trendelenburg and call the rapid response team. B. Obtain stat lab work including CBC and coagulation profile. C. Initiate IV fluids at maintenance rate. D. Encourage slow, deep breathing and reassure the client. Answer. A. Administer oxygen. Place the client in Trendelenburg and call the rapid response team. Rationale. Sudden postpartum cardiopulmonary compromise may indicate amniotic fluid embolism or massive hemorrhage. Rapid stabilization of airway, oxygenation, perfusion, and team activation is critical. Labs and reassurance are secondary. Trendelenburg improves venous return in hypotension. Question 12. A laboring client with a history of cocaine use presents with abrupt onset intense abdominal pain and uterine rigidity. Which finding confirms the nurse's suspicion of placental abruption? A. Painless, bright red bleeding. B. Continuous, tense, board-like uterus with fetal bradycardia. C. Gradual onset of mild contractions. D. Presence of accelerations on fetal heart monitor. Answer. B. Continuous, tense, board-like uterus with fetal bradycardia. Rationale. Abrupt onset uterine rigidity with fetal compromise is classic for abruption. Painless bleeding suggests placenta previa. Gradual contractions or accelerations are normal labor patterns and not alarming. Question 13. True or false? When a client with severe preeclampsia develops visual disturbances and epigastric pain, seizure precautions take priority over continuous blood pressure monitoring? A. True. B. False. Answer. A. True. Rationale. Severe preeclampsia signs, visual changes, epigastric pain indicate imminent risk for eclampsia. Seizure precautions, positioning, and oxygen readiness are critical. While BP monitoring is important, preventing maternal or fetal seizure is higher priority. Question 14. A client on magnesium sulfate has RR 8 per minute, absent deep tendon reflexes, and urine output 20 milliliters per hour. What is the nurse's first action? A. Discontinue magnesium sulfate, administer calcium gluconate, and notify provider. B. Reposition client and reassess in 15 minutes. C. Increase IV fluid rate to 150 milliliters per hour. D. Document findings and monitor every 30 minutes. Answer. A. Discontinue magnesium sulfate, administer calcium gluconate, and notify provider. Rationale. Classic magnesium toxicity, respiratory depression, absent reflexes, oliguria. Immediate reversal with calcium gluconate and provider notification is essential to prevent cardiac or respiratory arrest. Supportive measures alone are insufficient. Question 15. Yes or no? In a postpartum client with severe perineal pain and a rapidly expanding hematoma, should the nurse delay fundal assessment? A. Yes. B. No. Answer. B. No. Rationale. Uterine atony may coexist with perineal hematoma. Fundal assessment is critical to identify concurrent hemorrhage. Both findings require prompt evaluation and intervention. Question 16. Select all that apply. During labor, which findings indicate worsening uteroplacental insufficiency requiring immediate action? A. Recurrent late decelerations with loss of variability. B. Minimal variability without accelerations. C. Moderate variability with occasional accelerations. D. Sinusoidal fetal heart pattern. Answer. A. Recurrent late decelerations with loss of variability. B. Minimal variability without accelerations. D. Sinusoidal fetal heart pattern. Rationale. Late decels, minimal or absent variability, and sinusoidal patterns are ominous fetal signs. Moderate variability with accelerations is reassuring. Immediate intervention is needed to prevent hypoxic injury. Question 17. A postpartum client refuses blood transfusion after hemorrhage. Which nursing action demonstrates both ethical and legal accountability? A. Document informed refusal, notify provider, and provide alternative therapies. B. Administer transfusion despite refusal to prevent hypovolemic shock. C. Ask family to provide consent. D. Delay care until client consents. Answer. A. Document informed refusal, notify provider, and provide alternative therapies. Rationale. Nurses must respect patient autonomy and provide alternatives. Administering transfusion against informed refusal is assault. Documentation and communication are legally and ethically essential. Question 18. A fetal heart tracing shows variable decelerations with minimal variability. Which intervention demonstrates correct prioritization? A. Reposition client, apply oxygen, and notify provider. B. Administer oxytocin to augment contractions. C. Perform immediate amniotomy. D. Prepare for elective cesarean delivery. Answer. A. Reposition client, apply oxygen, and notify provider. Rationale. Variable decelerations indicate cord compression. Repositioning relieves pressure and improves perfusion. Oxytocin may worsen fetal stress. Emergency cesarean is not first line unless fetal status deteriorates. Question 19. True or false? Bimanual uterine massage is the initial intervention for postpartum hemorrhage with uterine atony? A. True. B. False. Answer. A. True. Rationale. Uterine atony is the leading cause of postpartum hemorrhage. Immediate fundal massage helps stimulate contraction and reduce bleeding. Delayed pharmacologic intervention is secondary. Question 20. Which clinical finding is the earliest and most reliable indicator of magnesium sulfate toxicity? A. Loss of deep tendon reflexes. B. Blood pressure elevation. C. Urine output less than 30 milliliters per hour. D. Facial flushing and warmth. Answer. A. Loss of deep tendon reflexes. Rationale. Absent reflexes appear before respiratory depression, hypotension, or oliguria. Early recognition allows timely intervention to prevent serious complications. Question 21. Select all that apply. Which actions demonstrate effective interprofessional collaboration during a postpartum hemorrhage? A. Using SBAR to communicate maternal status. B. Activating the obstetric rapid response team. C. Waiting for provider orders before taking any action. D. Assigning specific roles to each team member. Answer: A. Using SBAR to communicate maternal status. B. Activating the obstetric rapid response team. D. Assigning specific roles to each team member. Rationale: rapid communication, structured team response, and role clarity improve outcomes. Delaying action while waiting for orders can worsen hemorrhage. Question 22. A client at 37 weeks reports decreased fetal movement. Which step demonstrates the nurse's highest level clinical judgment? A. Perform immediate non-stress test and biophysical profile. B. Reassure the client and instruct to count kicks at home. C. Assess maternal blood pressure and pulse only. D. Encourage hydration and repeat assessment in 24 hours. Answer: A. Perform immediate non-stress test and biophysical profile. Rationale: decreased fetal movement is a potential sign of fetal compromise. Prompt assessment with NST and BPP ensures early detection of hypoxia and reduces risk of stillbirth. Delayed home monitoring is unsafe. Question 23. Yes or no? Is methylergonavine contraindicated in a postpartum client with pre-existing severe hypertension? A. Yes. B. No. Answer: A. Yes. Rationale: methylergonavine causes vasoconstriction, which can dangerously increase blood pressure. Administering it in hypertensive clients can precipitate stroke or cardiac complications. Question 24. Which observation best reflects advanced clinical judgment in preventing progression from mild to severe preeclampsia? A. Noticing subtle changes in mental status and escalating care immediately. B. Documenting mild headache without intervention. C. Administering antihypertensive medication after severe readings. D. Delegating neurological checks to assistive personnel. Answer: A. Noticing subtle changes in mental status and escalating care immediately. Rationale: early recognition of subtle neurological changes is crucial to prevent seizures or eclampsia. This demonstrates anticipatory and high-level clinical judgment. Question 25. Select all that apply. Which factors increase postpartum hemorrhage risk? A. Prolonged labor and use of oxytocin. B. Overdistended uterus, for example twins, polyhydramnios. C. Multiparity. D. Firm, contracted uterus. Answer: A. Prolonged labor and use of oxytocin. B. Overdistended uterus. C. Multiparity. Rationale: prolonged labor, uterine overdistension, and multiple prior pregnancies predispose to uterine atony. A firm, contracted uterus reduces hemorrhage risk. Question 26. Based on initial assessment, what is the nurse's highest priority intervention? A. Establish IV access and monitor maternal BP and fetal heart rate closely. B. Begin teaching the client about epidural options. C. Encourage ambulation in the hall. D. Document findings and reassess in 4 hours. Answer: A. Establish IV access and monitor maternal BP and fetal heart rate closely. Rationale: maternal chronic hypertension increases risk of preeclampsia. Continuous monitoring of maternal BP and fetal status is the priority. Ambulation, teaching, and routine documentation are important but secondary. Question 27. 2 hours later, the client reports headache and visual spots. BP is 160 over 100 millimeters of mercury. Fetal heart rate 150, with minimal variability. What is the nurse's next action? A. Notify provider immediately and prepare for magnesium sulfate administration. B. Reassure client and offer analgesia. C. Encourage deep breathing exercises. D. Continue monitoring every 30 minutes. Answer: A. Notify provider immediately and prepare for magnesium sulfate administration. Rationale: headache, visual changes, and elevated BP indicate severe preeclampsia. Magnesium sulfate and provider notification are urgent to prevent eclampsia. Reassurance or delayed monitoring is unsafe. Question 28. True or false? The nurse should prioritize maternal seizure precautions over continuous fetal heart rate monitoring in this client with severe preeclampsia. A. True. B. False. Answer: A. True. Rationale: maternal stabilization takes precedence. Fetal well-being depends on maternal safety. Seizure precautions prevent life-threatening complications. Question 29. During magnesium sulfate infusion, the client has RR 10 per minute, DTR 0, and UOP 25 milliliters per hour. What is the nurse's immediate action? A. Stop magnesium sulfate, administer calcium gluconate, and notify provider. B. Slow the infusion rate and continue monitoring. C. Encourage deep breathing and provide oxygen. D. Document and reassess in 15 minutes. Answer: A. Stop magnesium sulfate, administer calcium gluconate, and notify provider. Rationale: classic magnesium toxicity, respiratory depression, absent reflexes, oliguria. Immediate intervention is critical to prevent maternal arrest. Question 30. The provider orders induction with oxytocin. The client has a history of prior cesarean delivery. Which action reflects advanced clinical judgment? A. Verify VBAC candidacy and review uterine scar risk before starting oxytocin. B. Begin oxytocin immediately since labor is progressing slowly. C. Delegate monitoring to LPN or LVN.D. Document history and proceed per protocol. Answer: A. Verify VBAC candidacy and review uterine scar risk before starting oxytocin. Rationale: oxytocin increases risk of uterine rupture in VBAC clients. Assessing safety and eligibility reflects anticipatory clinical judgment. Question 31. Fetal heart rate shows late decelerations with minimal variability during contraction. What should the nurse do first? A. Reposition client, administer oxygen, and stop oxytocin. B. Call provider and prepare for cesarean delivery. C. Increase IV fluids only. D. Encourage maternal relaxation techniques. Answer: A. Reposition client, administer oxygen, and stop oxytocin. Rationale: late decelerations indicate fetal hypoxia. Immediate interventions to improve uteroplacental perfusion are priority. Cesarean preparation follows if fetal status does not improve. Question 32. Select all that apply. Which interventions are appropriate to prevent maternal complications during labor with severe preeclampsia? A. Strict intake and output monitoring. B. Continuous BP and fetal monitoring. C. Limiting fluid boluses to prevent pulmonary edema. D. Encouraging unrestricted oral intake. Answer: A. Strict intake and output monitoring. B. Continuous BP and fetal monitoring. C. Limiting fluid boluses to prevent pulmonary edema. Rationale: severe preeclampsia increases risk of fluid overload, pulmonary edema, and renal compromise. Unrestricted oral intake can worsen complications. Question 33. The client requests to refuse magnesium sulfate due to fear of side effects. Which nursing action reflects ethical and legal judgment? A. Provide thorough explanation of risks and document informed refusal. B. Administer any way to prevent maternal seizure. C. Ask family to consent on her behalf. D. Delay intervention indefinitely. Answer: A. Provide thorough explanation of risks and document informed refusal. Rationale: respecting autonomy while ensuring informed consent is ethically and legally required. Administering without consent is assault. Delaying care is unsafe. Question 34. Postpartum. The client has a boggy uterus and saturating pads. What is the nurse's first action? A. Perform fundal massage and assess for retained clots. B. Notify provider immediately and await orders. C. Increase IV fluids only. D. Document findings and monitor. Answer. A. Perform fundal massage and assess for retained clots. Rationale. Uterine atony is the leading cause of postpartum hemorrhage. Immediate intervention with massage and clot removal prevents further blood loss. Question 35. True or false? Administering oxytocin is appropriate only after fundal massage fails to firm the uterus? A. True. B. False. Answer. A. True. Rationale. Pharmacologic intervention follows manual methods. Uterotonic agents support contraction only after assessing response to massage. Question 36. The client develops tachycardia, HR 130, BP 90/60, and cold, clammy skin. What is the nurse's priority action? A. Call rapid response, begin IV fluid resuscitation, and prepare for blood transfusion. B. Administer antipyretics and monitor vital signs. C. Encourage the client to rest in bed. D. Document vital signs and notify provider later. Answer. A. Call rapid response, begin IV fluid resuscitation, and prepare for blood transfusion. Rationale. Classic postpartum hemorrhage signs with hypovolemic shock. Immediate intervention is required to prevent maternal death. Question 37. Select all that apply. Which findings indicate hypovolemic shock postpartum? A. Tachycardia and hypotension. B. Pale, clammy skin. C. Oliguria, less than 30 milliliters per hour. D. Warm, dry skin and bounding pulse. Answer. A. Tachycardia and hypotension. B. Pale, clammy skin. C. Oliguria, less than 30 milliliters per hour. Rationale. These are early shock indicators. Warm, dry, bounding pulse is not consistent with hypovolemic shock. Question 38. The client refuses blood transfusion despite severe hemorrhage. What is the nurse's best action? A. Explore alternative therapies, document refusal, and notify provider. B. Administer blood to prevent maternal death. C. Delegate transfusion decision to family. D. Wait for client to change mind before acting. Answer. A. Explore alternative therapies, document refusal, and notify provider. Rationale. Respect for autonomy is legally and ethically binding. Alternatives include iron therapy or volume expanders. Administering without consent is assault. Question 39. Postpartum. The client reports headache, BP 170/110, and blurred vision. What is the nurse's first intervention? A. Administer antihypertensive as ordered and assess neurological status. B. Reassure the client and encourage rest. C. Document and continue routine monitoring. D. Encourage hydration and repeat BP in 2 hours. Answer. A. Administer antihypertensive as ordered and assess neurological status. Rationale. Severe postpartum hypertension can progress to stroke or seizure. Rapid intervention is necessary to prevent catastrophic outcomes. Question 40. Select all that apply. Which postpartum interventions reduce maternal fetal risk in high-risk hypertensive clients? A. Strict blood pressure monitoring and antihypertensive therapy. B. Early ambulation and hydration. C. Monitoring for headache, visual changes, and epigastric pain. D. Fundal massage and assessment of lochia. Answer. A. Strict blood pressure monitoring and antihypertensive therapy. C. Monitoring for headache, visual changes, and epigastric pain. D. Fundal massage and assessment of lochia. Rationale. High-risk clients need continuous monitoring, prompt intervention for hypertension signs, and uterine assessment to prevent postpartum hemorrhage. Early ambulation may increase fall risk if BP is unstable. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.